Okay, good afternoon, everyone, and welcome to IBI's webinar on health and well-being for the remote and hybrid workforce. Today, we are very excited to talk about this very important topic that many of us are discussing around the virtual water cooler these days. Myself and Carole Bonner, who is our lead researcher on this project, will be presenting IBI's research and the data findings that we came up with. And then we're really honored to have Brian Davey, who is the Director of Health and Safety at World Bank, come and have a conversation with us today to talk about how World Bank approached these issues and how they're trying to solve for them going forward with some best practice advice for us. So thank you very much to Brian for joining us today. So we'll just do a real quick background on what this issue is that we're talking about today. Carole will lead us through what the research questions were. The way we develop research questions here at IBI is we ask our 1,400 plus members, most of those are employers, what they'd like us to research each year. And obviously, pandemic-related topics were a very hot thing this past 2 years in our research agenda. And then we take those questions, use a research committee of SMEs in the industry to help us really form what it is we need to inform employers with their strategy. And then we look for large publicly available data sources. As a nonprofit, we do really very rigorous academic research here. And then we present our findings back out to our research committee, hone the results, translate it into actionable items that you all as employers and vendors can relate to your day-to-day work. So the topic today, who isn't talking about health and wellness in a hybrid and remote workforce, and really employers struggle and continue to struggle with this particular topic. We are all really challenged in this environment with knowing what the right model is, whether it's fully return to work, whether it's a hybrid model or full remote work. There are bits and pieces of each of those that we got thrown into during the pandemic that bring their own unique challenges. For folks who are trying very hard to attract and retain employees in this work environment that we're in today, having the flexibility in your work strategy, return to office strategy, is extremely important. But employers are really struggling with, where is the data to know that A, is their strategy working in this moment? B, are their employees happy or at least satisfied with the strategy? And then C, I think the biggest challenge has been having the flexibility to meet the needs of the people where they are in their particular lives each day, but also be able to get the work done and make sure that productivity, absenteeism, presenteeism, mental health issues are being addressed. And honestly, I just don't think we have enough data right now to know where those models are working, where they're not. I think they both, and all three models, have challenges that come along with them. And what we're really trying to figure out here is, where do we go from here? So I'm going to turn it over to Carole. She's going to walk us through the research, what the research questions were that we were trying to solve for, and then what our findings were. So I'll turn it over to you, Carole.
Thank you, Kelly. So we know that as Kelly said, the pandemic has disrupted labor markets, and we're in this sort of global experiment of flexible work arrangements. The definition of workplace is rapidly changing, and those changes are likely to be around for a while. So we're at this watershed moment, and LinkedIn reports that members are posting more about flexible work, well-being, and company culture to compete with today's sort of reshuffling of employees. So we're looking at how can we support these employees. So when looking at the literature that's out there, and there's plenty out there, I found this research by Pew that talked about why people are quitting, and what they're hoping to gain. So 63% said pay was too low. 48% said they had child care issues. 45% said they didn't have flexible hours. 63% said they didn't have advancement opportunities. 57% felt disrespected at work. 43% said their benefits weren't good. So people left their jobs. And this is where we find them now. 78% have a new job. 61% said it was easy to find that job. 56% said they're earning more money. 53% said they have better advancement opportunities. 53% said they have better work-family balance, and 50% said they have more flexible hours. And so this kind of answers some of the reasons that people are looking for different situations. So in this research, we're looking at 4 questions. The first is, what are the differences in socio-demographics for employees who work in person, hybrid, or remotely? What are the challenges of working from home, like staying motivated or having the proper workspace or the technology that they need? How did productivity change from pre-pandemic for those who transitioned to remote during the pandemic? And how do we define engagement? And more importantly, how does hybrid remote work affect engagement? And so we found a data source, and this is also from Pew, American Trends Panel, and they are a leading think tank in the US for unbiased research. It's a nationally representative data set. The data set focuses on October 2020, and they have a follow-up survey taken in January 2022. And this is 10,000, more than 10,000 people surveyed. 5,800 of those were employed. So we're going to talk about first the work environment. So among adults who can perform their job at home, in 2020, 71% worked remotely. 12% had a hybrid work arrangement, and 17% worked in person. Following up in January 2022, 59% were remote, 18% were hybrid. So that means that only 5% transitioned back to in-person. Looking at the demographics, we see that metro areas and private organizations tended to have more remote workers. You see 73% for metro, 74% for private industry. The Midwest and South had fewer remote workers. South had more hybrid, which is interesting. And there was no significant difference by age. And this is particularly interesting, females had more to fall in the bucket of in-person. So we had 20% in person. So an estimated 29 million women were working in person compared to 23 million men. Looking at education level, those who had higher education tended to work remotely. And those who were married or living with a partner, as well as those who were never married, had more in the remote work environment. And people with higher income tended to work remotely. Most of those were not surprising. The female demographic was surprising to me. And let's look at challenges. So we know that, out there you hear a lot about everybody wants to be hybrid, everybody wants to be remote. But there are some challenges. So when we look at the data, we find that people who are working remotely, more of them are more satisfied. Those who are working remotely are more productive, and more fall into highly engaged. And we'll talk about this scoring later. So they're more productive, they're more satisfied, they're more highly engaged, but we've got challenges. So there are lots of pain points, and this does not even touch on all of them. 32% said they have difficulty getting their work done without interruptions. The children are coming in, the phone's ringing, the UPS guy is coming to the door. 18% said it's harder to know what their supervisor expects of them. That's concerning. And I think we'll address later some of those remedies. There might need to be specific training for managing the hybrid and remote workforce. Also, 23% are finding it difficult to have an adequate workspace. And this number, 21%, is for the follow-up in 2022. So it's not changing much. Basically, if you don't have the workspace, you don't have the workspace. 36% are finding it difficult to be motivated to do their work. 19% is having difficulty meeting deadlines and completing projects, but that number has come down to 10% in 2022. 25% says they're working more hours. 27% say that it's more difficult to balance work and family responsibilities. And that number has come down to 10% in 22. 30% say technology is not a good substitute for in-person contact with coworkers. And 14% said that they find it difficult to have the technology and equipment needed to do their job. So, work-family balance seems to be a very big issue. 27% say that it's harder. 45% say they're not spending enough time with their kids. 40% say they're not spending enough time with their partners. So, I want to ask you, I'm going to do a short poll, very, very short. How has working from home impacted your work-life balance? Is it easier, harder, about the same? Take a second and just answer that for us. We want to gauge the temperature in the room. Okay. So 67% of you said it was easier, 11% say it's harder, and 22% say it is about the same. Great. So, gauging what this survey, it's about the same. 64% said it was easier, 20% say it's about the same, and 16% say it's harder.
So Carole, I want to jump in here real quick, and because Brian and I are going to talk about this a little bit after you're finished. But this idea that we are still trying to measure work-life balance, I think we need to kind of shift the paradigm a bit. I don't think it's any longer about work-life balance. It's just about life balance, right? Because our work is our home, is our life, is our environment. And so I think employers as a whole, and we in the industry need to start thinking about just life balance, because that's how humans think about this. So it doesn't surprise me that people are saying that it's easier to work remotely. But for an employer who's trying to determine if that is both a business goal decision and an employee satisfaction decision, it's really hard to measure whether just because you're happier to be working at home and not sitting in traffic is good for the business. So we're going to talk about how employers are challenged to figure out this new paradigm of life balance for their employees while still maintaining their, internal KPIs, right? Just a point to consider for later discussion.
Thank you, Kelly. So let's talk about that. Let's talk about productivity. So this view is for people who have transitioned to work from home. Okay, there are those who worked from home prior to pandemic, and then those who didn't work from home but now are working from home. And those who transition, 27% say they are more productive compared to 16% who that was the norm for them. All right. And talking about work-life balance, if you have the same balance, it makes room for being more productive. So 43% said they had the same balance that they had prior to working from home, yet they're more productive. When, let's look at this, employees who are more productive are prone to work-life balance. So we seem to have more balance, more productivity. So when balance doesn't change, productivity is less likely to change. And if balance drops after transitioning, if this is harder for you, then you're likely less productive. So employees who find it more difficult to balance work life are between 2 and 3 times more likely to be less productive. So let's look at engagement. And this was a measure that wasn't clear in the data. It's a composite of many things. So in the literature, organizational psychologists and researchers refer to engagement as a component of work-related well-being. So it can be characterized by a positive, fulfilling work-related state of mind with high levels of energy and mental resilience while working, a sense of significance, enthusiasm, challenge, and being focused and happily engrossed in work. And this is supported by tons of literature. So looking at our survey, we looked at certain questions to gauge engagement. And so it's a component of all of these things. Are you productive? Are you optimistic? Did you prefer working from home? Are you stressed and anxious? Did you ever feel like you couldn't give 100% because of balancing work and parenting responsibilities? Are you more satisfied? Are you finding it easy or difficult to meet your deadlines? Have you had to reduce work hours, or have you had to turn down assignments because of balancing family and work? Are you feeling motivated? And so you'll see some of those involve family and work. And so we have two buckets. We have those who don't have children and those who do. So these slides are divided into children, no children. Okay. So more remote employees indicate they were highly engaged. So you see highly engaged. This is with children, 24%, without children, 21%. Low engagement, you see more in person. Low engagement, in person. You have more who responded that they were in the low engagement bucket. Okay. And more remote hybrid employees with children indicate they are highly engaged versus those without children. So with children, without. When we look at age, you'll see that people 30 to 64 are more likely to be in this highly engaged category. And more 18 to 29 in this low engagement category. When you look at industry, low engagement was an average of 12.3%. And you can see this imaginary line, and these who have more, who fall into that low engagement bucket, were agriculture and retail, right? And those who are doing better in that low engagement sector are IT and government, public admin. Highly engaged, we had more people, professional, scientific, and banking, finance. And that average was 23. Okay, and this is remote and hybrid workers. So one more poll before we end my segment. Does your organization provide education or training to managers and supervisors on any of the following topics? So check all that apply. Okay. Do we have the results? There we go. Oh, great. 45% are training their managers, supervisors to spot stressors and signs of burnout. 55%, this is great, are training to communicate effectively with hybrid, remote, direct reports. It's 55%. 52% are training on personal resilience, and 69% are training on emergency preparedness. Wonderful. All right, and so just to briefly recap, 83% of workers were remote in 2020, 5% transitioned from remote to in-person. The remote worker is more likely to have increased productivity, satisfaction, and high engagement. Work-life balance is paramount to engagement. Many challenges negatively affect productivity and engagement, and so employers should carefully consider resources to support employees facing challenges. And at this point, when we're talking about solutions, I'm going to turn it back to Kelly.
Great. Thank you, Carole.
Thank you.
So I realize that, data and looking at data responses is not always the most exciting work, but in this particular case, when we're asking very pointed questions about how employers can approach this going forward, it's really what we have to look at. And we want to acknowledge right up front that there is typically a disconnect between what employees say they want, what they really want, and what is good for them and for the business. One question came into the Q&A box about how employers are approaching these issues, deciding on a strategy, whether it be hybrid, work from home, or fully return to work. When you're talking about an RTO strategy, at the end of the day, you have a bottom line to meet as a business. And, thinking about some of the smaller employers, mid-sized to small market employers, they may be making business decision based on whether they can stay in business and be profitable, or whether they have the money and the flexibility to both pay for office space and pay for people to be working at home. These are huge decisions for some employers. They don't have the luxury of saying, all right, I'm going to let everybody home for another year because they all want it and they say they need it for their work-life balance, but I'm paying for 2 office spaces, one in someone's home and one in my office building. And so these become bigger business decisions than just attraction retention conversations, right? So we realize going into this discussion, we don't have all the answers here. We can only see how people are reacting in the research, in the data, and then try to come up with best practices for employers to start addressing these things. One thing we do know is you'll read a lot in the press today about, first of all, the mental health aspect, which Brian and I are going to talk about. How is this affecting people who we sent home maybe 2 years ago now or more? And you saw from some of the answers, one thing I thought was really interesting was that people who are working from home, who are full-time work at home, or I'm sorry, in person, who are back in person, are not necessarily feeling engaged. So even the people that are going back to the office, I think are struggling. And partially because there's a lot of unknowns out there. Many employers are saying, okay, we'll try it. Let's go back to the office 2 days a week. You pick your days because we're trying to be flexible and meet your needs. Employers are going back to the office and there's nobody there, or they're not there at the same time, or they're not there on the same days, or they go back to the office and they're IMing each other from their cubies. So is that really meeting the goals of the company to get people back together and engaged in person, to have that innovation conversation happening, the creativity, the socialization that we all crave? Are those goals being met by this sort of, we're trying to wrap our arms around you and give you what you want strategy? I don't think it is. Are employers who are taking a hard line and saying we're all going back 5 days a week, like it or not, and then causing stress and mental health issues for people who are not ready to do that? Those are the questions we're going to explore today. But the reason we do this research is to try and find answers, at least in the data. So I'm going to introduce Brian Davey again from World Bank. Brian, thank you and welcome.
Hi, Kelly, and good day, everyone.
So, Brian, one of the biggest concerns as we sent people home at the beginning of the pandemic was how obviously this was going to affect them mentally, not just the halo effect of all the things that were happening during the pandemic, the fear, the uncertainty, et cetera, and the health issues. But, back in the day, you had to earn the right to work at home. We screened people, we made sure they met productivity goals and that they had a personality that really supported a work at home independent environment. Now we just sent them home and hoped for the best. right? And in some cases, that wasn't something that was best for that person that was sent home in the work environment. And so now we're having to go back and look at that to see, have we affected people's well-being? Have we affected their mental health, their stress levels, their creativity, their ability to work under pressure, meet deadlines, and feel engaged? So obviously this mental health and wellness has been a huge topic of conversation for these last 2 years. But as we move forward, accepting the fact that this hybrid or remote work model is probably here to stay, at least for the immediate future, how have you approached this challenge at World Bank? And will you make changes, or have you made changes in your strategy going forward to support that mental health of your workforce as you work in these new environments?
Yeah, thanks, Kelly. And those are all very relevant points, and a number of those features and findings that you mentioned certainly resonate with us. I think we are very little different to most of the other employers on the call. Maybe I should just clarify briefly what and who the World Bank Group is. We're not actually a bank in the traditional sense. We are a very large development organization which is linked to the United Nations system. So in fact, we are recognized as a specialized agency in the UN alongside groups like the World Health Organization, the International Monetary Fund, etc., which has some nuances when it comes to dealing with crises and health issues, because we actually sit outside of national control systems. Our offices around the world have the status of embassies. So that has certain advantages, gives us certain flexibility that national groups may not have, but it has its own set of challenges as well. But most pertinently, we're pretty much everywhere. So we have about 34,000 staff, more or less equally distributed between our headquarters in Washington, D.C., and then spread across around 160 offices around the globe. So you can imagine there's every combination of circumstance, challenge, of types of employees, of people, and approaches to these issues. So the name of the game in everything we do and have been having to do over the last 2 years of the pandemic has been flexibility. There's absolutely just no one size that fits all. So a lot of our decision making is decentralized. But getting back to the topic we started on of mental health, this of course wasn't only a challenge during the pandemic. It's always been a challenge, and I think everyone recognizes, and it's a growing recognition, just how critical and important mental health issues are. Whenever we look at our health and wellness figures, the mental health group of diagnoses and conditions is always in the top 10, both in terms of prevalence and in terms of cost on our health insurance plans. But recognizing also that the other top 10, the things that also you all deal with, I'm sure, cardiovascular disease and diabetes, high blood pressure, back pain, all of those issues, the outcomes are much worse when there is a comorbid mental health condition. So really, if you don't deal with mental health, you're losing a huge opportunity, and it's just become a priority for all employers to be aware of and to manage mental health. As I said, before the pandemic, this was just as much of an issue as it was during, but the pandemic changed a few things. And when we did ask our staff in a survey, how did the pandemic affect your current state of mental health and well-being? You can see here, the blue on the left is people saying that their mental health and well-being is worse. And this was around December 2020. So of course, at the peak of the pandemic. But, up to half of staff experienced a worsening of their mental health picture, despite the fact that they were all very grateful to be working at home and also reported that they were more productive when working at home. So I think this links with some of what Carole was saying, is that yes, people prefer working from home or hybrid if necessary, but that doesn't mean that it doesn't have challenges. And of course, in the middle of the pandemic, there were very specific challenges. There were the concerns about the pandemic itself, but the way it impacted work-life demands, constant availability on call, starting earliest, ending later, I think had a very real effect. And if you look at the specific issues that people identified, just look down at the bottom here, the main issues of work hours, deadlines, working priorities, resources, these are not things that mental health professionals can do anything about. This falls fairly and squarely in the purview of management and managers. And another, I think, very interesting observation that came out of the McKinsey Health and Wellbeing survey this year in 2022 was the striking observation that the issue of toxic behavior or difficulties and relationships in the workplace is actually the single most important factor in terms of predicting negative outcomes. So you can throw as many EAPs and psychologists and stress management programs you like at your staff, but if you're not dealing with the issue of relationships in the workplace, you're not going to make headway. I think that was a very important observation. So how did we start to think about this? Now, this wasn't purely precipitated by the pandemic, but it was already in process before the pandemic. It just, interestingly enough, I think my unit and many other health units around the globe saw considerable growth during the pandemic. A lot of organizations really realized the value. But one of the most important reorganizations we did was in how we think about organizing ourselves to deliver what we call integrated health and safety, and make sure that mental health and well-being is always part of every consideration. And I won't go into detail, but this is essentially how we have structured ourselves. And we have our three primary domains of health and safety, which are the personal health and wellness, the individual's health, the occupational health and safety, which is the interface between the individual and the workplace, and then the whole bucket of mental health and well-being. We try to bring those three domains around the table and target it towards every problem we deal with. But to do that effectively, and this may be different to some other traditional health units, we've introduced what we call a strategy and operations function. And this is a manager that is tasked with ensuring that there is a mutual synergy between all these groups, right the way down to the ground level in all our outposts around the globe. And that we have not just doctors and nurses thinking about things, but also occupational health ergonomists, counselors, etc., bringing this multidisciplinary tool in which mental health is always part of it. But so critical, and this really was during the pandemic, the key to our response was adding in a dedicated data and analytics function so that we could deal with real issues that the data supported and helped us prioritize, but that communications and knowledge management and our digital footprint became the primary tools. You know, in the world of occupational health and safety, we traditionally rely on individual consultations, prescriptions and stethoscopes and medical tools. But in this world we're in, your tool is communication. So if you don't deal with it, and if you don't have the ability to throw out, this is what our website looked like in 2020, and you can see that mental health was right at the top of what we were talking about. And intriguingly, when we look at the response of staff to that, this is the growth of attention to this new digital footprint we have, going from in our financial year 2020, from around 81,000 page views from about 18,000 people involved, escalating up into our current financial year, where we have literally more than double the number of staff who are interested in what we're doing. Now, that is not just pandemic. Back in 2020, the top pages visited all had to do, have a look at that. It was, yes, of course, COVID advice, but the counseling page, the psychosocial support, the relaxation meditation, that was the primary interest of staff coming to look for help. When we look now, things have changed a bit. The mental health things are down at the bottom. But this tool, this method of reaching out, has remained absolutely our primary tool, along with, of course, a big switch to apps, which we didn't have much capability of before. So all of that was just so important in enabling us to meet this whole need. But having talked for the last few minutes about medical and health and safety issues, I think one of our other most important messages and points of advice to any group that is starting to develop and implement a mental health strategy is don't over-medicalize it. In fact, try not to medicalize it at all. Of course, the health and safety folks will do what they need to do, as I've been talking about. But to get traction, you need recognition of how important the managerial element is. And the mental health strategy and the leadership and the communications needs to come from senior management and cascade down the management chain, which we can perhaps talk about in a while. So let me stop at that point. That was probably more than you wanted in that answer.
No, that was exactly what we wanted and perfect. I think that, to your point, two things: sending people home or into a remote, hybrid remote workforce is risky because you lose, first of all, being able to see the person face to face and see how they are faring or performing at work. And you also lose that sense of engagement and connectedness between the teams, between their managers, etc. So a question for you, how do you, in this environment where your people are remote, how do you make them feel heard and supported? You've already answered that question with your reach out on your website, the app, etc. So you've given them the tools that they need. But now, how do you measure that that is working? How do you have a data flow to come back to you, or a survey mechanism, or a town hall, or sort of a interview process with your employees to understand that they're saying, this is working for me. We like this. We have engagement in the tool. We are using the programs that are attached to the tool. How are you measuring that, Brian?
Sure, Kelly, and that's, yes, absolutely, it's critical. And I think, as I said up front, the first key tool is being flexible and recognizing that the solutions are going to be different, both for different people and for different groups and different units, and depending on what their primary function is. So I think you just can't have a written in stone solution that is rolled out and expect that people will make do with it. I think the other part of this is, and I think we saw this up at the beginning of the pandemic, when it was the other way around. We were all suddenly precipitated from the office to homes. And there wasn't a lot of talk of how to do it. We just started doing it. So it was pretty much learning on the job. But as we come back into the office environment and making it hybrid, I think it's so important not just to do it, but to constantly talk about it, evaluate it, and adapt it. And I'll share a couple of tools that we've been using, and this was mostly managed by our HR group. But there were a couple of distinct programs introduced, and I certainly found them extremely valuable. They're ongoing with my own unit. Starting with a whole set of engagements that was simply entitled The Soft Skills of Hybrid Work. And this involved getting everyone in the unit together. Of course, that involved hybrid sessions in itself. But talking about shifting the mindset from an office-centric approach to a people-centric approach, so that people became aware that what we were doing was looking at relationships between people and focusing on that, whether it was being done through remote means or in person that everybody was used to. But the focus was really in four main areas, and that was taking on a growth mindset and realizing there are things to learn here. And this is not going to be natural for anyone. But very importantly, building an environment of psychological safety where people felt they could speak up. And I think that was one of our challenges with the remote. It worked, everyone did it, but it certainly, there were some individuals who really fell into the background, either because just of their personalities and feeling insecure about jumping forward and being the one visible on the screen, or just feeling a little bit overwhelmed and maybe thinking about other things. So being able to speak out safely and feel secure, confident that your views will be heard is so important. But bringing awareness and practice in around emotional intelligence, but also doing regular team retrospectives. And what in fact we did was come up with a kind of a charter. And again, this will be different in between different units, but actually writing down and committing so that everybody could see it, how we would be communicating, when we would be doing it. We agreed on certain core hours, and that didn't mean we all had to be in the office at the same time, but we could all speak to each other at the same time. We agreed that we would have a weekly check-in and how we would, for example, share the recordings of meetings that had been remote so that everybody could look at them, but also finding ways to make our in-office schedule visible to everybody. And in fact, the organization took that on. Anyone in the organization can look on the intranet, type my name in and see if I'm in the office or not. So I think all of those have helped. But flowing on, we involved now in the second deeper dive into the 4 stages of psychological safety, as they call it. And that is, in fact, a 4 to 6 month engagement facilitated where our teams are doing surveys, one on how they are operating with each other, developing specific targeted action plans with assisted interventions where needed, but also committing to regular check-ins. And it's in fact become part of our work plan. And I think if you don't structure it around that type of active talking about how we work, evaluating how it's working with us, I think you will struggle if you just leave it to evolve of its own.
Yeah, I think you're right. And one of the things that we heard in the employer feedback, if you look at Carole's paper, it includes an employer guidance section. And one of the big topics that employers are dealing with right now is this education of their frontline managers and supervisors.
Right.
So, not only did we have to overcome a pre-pandemic issue in stigma, but we had to now train managers and supervisors how to understand, recognize, and talk about things like, stress and burnout and mental health issues in a hybrid or remote workforce, as well as an in-person workforce. One thing to be able to see Bob is struggling, in a manufacturing plant because he's standing in front of you and Bob's just not himself today. It's another thing to be able, as a manager or a supervisor, to be trained and comfortable and safe enough to go up and ask Bob if he's doing okay. And then further, to know what to do about it if Bob says, nope, I'm not okay, right? How to lead him back through those products and programs that are available to support him. And so I think manager and supervisor and even executive level training is one of the big takeaways that we had from this project. We need to be able to help those who are helping your staff, your workforce, right? So moving on to the next question. Obviously, we are in this situation where employers have to prepare a return to office strategy. And, we've seen the news that some are going to the far extreme of tracking productivity in their remote workforce or hybrid workforce by tracking every single thing they're doing, right? Keystrokes, is your mouse moving? Is your laptop idle for this long? And I think that creates its own sense of stressors for the employee who knows that you're doing that. But it also is a sign that employers don't know how to figure out right now. Are there people working? Are they being productive? Are deadlines being met? And lastly, but probably most importantly, are they okay? Are they happy in their job? Are they going to stay here? Are they fulfilled? Are they thriving or are they struggling? So how are you approaching this? And I think uncertainty, we talked about uncertainty. Some employers have changed their RTO strategy 10 times in the last 10 months. And so me as an employee, how am I to bank on which days I'm going to the office, which days I need childcare, which days I need to change appointments, et cetera? How are you all approaching this whole return to office strategy? And I know you're uniquely situated because you're all over the world, but how are you approaching this issue?
Yeah, and I think the single word I can use to describe how we're approaching it is flexibly. As I said at the beginning, there really isn't a one-size-fits-all solution for us. In the different parts of the world, our offices are in different cultural environments. They're dealing with different types of clients, and often the clients actually dictate some of what we need to do. There are some clients that simply insist that the meetings take place in their offices. And, we've been in the situation where we as an organization with our own monitoring of health indicators believe the offices should be closed. But in that particular country, the entire country is open and the government offices are open, and it just looks a bit odd that bank staff would be sitting behind closed doors and nobody else. So we have to adapt to that. We also have nuances. One small example, it impacts me. I'm in the United States on a so-called G4 visa, which is a diplomatic visa. And, the US government gives the visa because there's a need for me to be in the country. Now, if everything I was doing was remote, the need would fall away and it would draw into question, why is it that we're undergoing such or subject to such expenses of keeping people in the capitals. And in fact, there are certain time requirements that people that have certain visas, and this is different around the world, need to be in the office. So all of those issues need to be flexibly addressed. But getting to individuals, in my unit, I have a travel clinic with nurses that do vaccinations. They can't do that from home. So that function has to happen every day at the office. But we're trying to rotate the workload, and so at least some of the administrative work which can be done remotely, although those nurses have to accept that there will be shift days where they have to come in.
Yeah.
Ultimately, I have other staff whose work is all servicing from DC, is servicing country offices, which even if we were not in a pandemic situation, would be done remotely. So
Sure.
Again, you have to adapt flexibly, but the key, I suppose, we also have the advantage that we have so many models ongoing simultaneously around the world. We have the luxury of seeing what's working and
what's not, right?
From all of that.
Yeah.
But the single key is regular team check-ins and reporting back and just keeping your finger on the pulse, what is working and what is not.
Right. I have a great question from the audience here, John. How is learning and development offered through remote learning been employed to improve communication skills, advancement opportunities, and enhance culture and address talent acquisition and retention? Are you doing that remotely or still in person? How are you handling learning and development?
Yeah, well, again, we were we always did, because of the nature of the organization and how widespread across the globe there was. I think we had the advantage that a lot of the learning and development was in any case being done remotely. Of course, we went through then 2 years where all of it had to be done remotely, and that saw leaps and bounds in our capabilities, both on a technical level. Our IT group really jumped to the challenge, and I think we were all surprised at just how effectively it all went. But as we come out of the pandemic, as I illustrated with our own health and safety related tools, we're just seeing that so much can be done more efficiently than we did in the past using these remote tools. And in fact, we've cut down our travel costs significantly because we've realized, the old habit, the old style was when you wanted to deal with an office, you traveled there. Now we can do a lot of that remotely, but not all of it. And I think we don't want to lose sight of the importance that the hybrid approach, in fact, offers the greatest benefits. So it's being aware of what can be done remotely, but of course, recognizing that the real brainstorming type interactions often work better when they're part of training courses, and making sure that those opportunities are still there.
Yeah, I think if nothing else, we've had a couple of really great silver linings, learnings from the pandemic. And one of those certainly has been a jump start in technology and the ability to do some of the things that we never have done before remotely, and improvement in the quality of those, everything from, mental health availability through apps and technology, all the way through to like learning and development that has improved vastly over the last 2.5 years. So Brian, I want to thank you. We only have 2 minutes left. If there's any more questions in the chat, I've already answered everything that is in there so far as we've gone along. So I want to kind of wrap up by talking about, obviously IBI produces these research papers 5 a year on the topics that our members vote on. As I said at the top of the call, this is a huge issue that is an ongoing issue that is still in flux, right? So we have employers who are still dealing with this whole idea of what the right model is for their people. And I think Brian has demonstrated, that it doesn't have to be one model for all, which a lot of employers are taking that approach now. And maybe out of necessity. I do want to acknowledge that it might be a cost-driven factor or a culturally driven factor that is pushing them towards one model or the other. I think that flexibility and having the certainty for employees to plan their work schedule, their life schedule around their work is very important. Having changing an RTO strategy month to month, week to week creates uncertainty and stress in the workforce. We heard that loud and clear. I think that training for your employees who are dealing with the workforce is extremely important so that the people who are in the know are truly in the know and can handle these. And then lastly, obviously, working in the environment we are today, not drowning your rock stars. So if you're short-staffed and you have people around the world whose workloads have doubled, you want to really monitor that and make sure that the people that you do have left are quality workers and are happy at work, well-balanced at work, thriving at work, so that you don't have attraction and retention issues in the long run. Again, an ongoing problem that we're going to continue to monitor through our research and through our employer friends who give us guidance on these. So thank you, Brian, very much for spending the time doing that today. And thank you, Carole, for spending your time doing the research and presenting it to everyone. This will be up on the IBI website for members as a recorded webinar, and the research paper and infographic are available there as well. Thank you all for joining.
Thank you. Bye.